I'm going to be discussing insertion of a nasopharyngeal airway, also known as a nasal trumpet. I'm going to go through some things on my handout, so if you have access to that or the textbook, the skills textbook, you're more than welcome to follow along during this process. So here we go. So the purpose of the nasopharyngeal airway, it's a device that, unlike the oropharyngeal airway, it's actually placed through the nose and then it rests in the back of the throat. This device is better tolerated in conscious, awake, and alert patients. It usually doesn't cause gagging. It's usually a little bit more comfortable for these patients. And we'll use this device, say if the teeth are clenched or the tongue is so large that we can't even insert an oropharyngeal airway. So those are some of the scenarios that we would place the device. Also, if we anticipate doing a lot of nasal suctioning, nasopharyngeal suctioning, we'll place this device. That way it protects the nasal mucosa from trauma and damage from frequent suctioning. So the next thing we're going to do is we're going to assess our patient. I'm going to be demonstrating these skills on myself, doing the best I can. I don't really have props or currently a roommate to demonstrate this on, so just bear with me. So the next thing we're going to do is we're going to assess the need for this device. So first things first, we're going to check our patient's level of consciousness. We're going to pretend like my patient, Sam, he's awake, he's alert, he's just having some problems breathing. So we're going to look at his respiratory rate, the depth, and the effort that he's breathing. We're also going to listen to lung sounds. We're going to do that in the front, and we're going to do that in the back, and we're going to note any sort of diminished sounds, any sort of crackles, gurgling, anything that would warrant us to say there's something wrong here. And it provides us a baseline, so once the device is placed, we can determine its effectiveness. We're also going to look at oxygen saturation levels. If they're a little diminished, it may also indicate the need for this device. And then we're going to note secretions that are in the oral cavity and in the airway, just making sure we note the amount, the color, just making sure we've covered all our bases before moving forward. So we've assessed the patient, Sam. He has some diminished lung sounds. His rate is kind of increased, and his effort is a little bit more labored. So next, we're going to look at anything in Sam's chart that would indicate a contraindication of this device. So the contraindications for the placement of the device would be any sort of nasal or oral surgeries that have been done recently, if they have a deviated septum, if there was a brain injury, any sort of facial or skull fractures, or if they're on any sort of anticoagulant therapy. All of these scenarios would contraindicate the insertion of this device. So our patient Sam, we've looked in his medical record, we've done an assessment, we've determined that he has none of those situations going on, so now we're equipped to proceed. So the following things we're going to need is, of course, we're going to need a nasal trumpet. This is my kind of rednecked rigged device, so just bear with me. This is what I'll be using to kind of demonstrate, but I also have pictures on my handout. This is what the device actually looks like. All right, so the things we'll need our nasal trumpet of the appropriate size. We're going to need some disposable gloves. We're going to need suction equipment, lubricant, mask, and goggles if needed. So we've gathered all our equipment, we've checked the order, we're moving forward to the next step. So the next and most important step is sizing of the device. So these devices, the nasal trumpets, are measured in the French scale, just kind of like our other catheters. So usually for adults and adolescents, the range is 24 to 36 French. Again, you want the biggest diameter that can fit in the nostril with the appropriate length. That way you get the most bang for your buck. So to determine the size and the length of the device you'll need, you're going to place the airway on the side of the patient's face. So we're going to place this device. This is the tip guard, or this is the guard rim. This is the channel, and then this is your tip here. So we would actually place this device like this, measuring and seeing if it can reach from the tip of the nose to the tip of the earlobe. So this works on our patient Sam, and a better picture is in my handout. It should look like that. It should be able to reach from the tip of the nose to the earlobe. That confirms proper length, and then we'll want to make sure that that diameter is big enough to where it can still fit in the nostril, but it's not going to go anywhere. So we've determined good sizing. So before we insert this device, I would like to go over with you some unexpected situations that may occur. That way you know on your patient what the best method is. So if your patient begins to cough or begins to gag, that could potentially mean your device is too long. You need to remove that device and resize your patient. Okay, since we've gone over all those things, we're actually going to go over the insertion of this device. I have attached the steps directly from the book on my handout, or you're more than welcome to just look in the book as well. So we're coming in, we're seeing our patient Sam. The first thing we're going to do is we're going to perform hand hygiene. So I'm washing my hands, and then I'm going to put on PPE if it's indicated. Next thing I want to do is I want to identify my patient Sam. Sam has confirmed his name, his date of birth. He's awake and oriented. He knows where he is. Next step, we're going to assemble all our equipment on a table close to Sam's bed. Next thing we're going to do is we're going to provide Sam with some privacy. We're going to close the curtains around the bed and shut the door if possible. Next, we're going to explain why we're doing this procedure. So we're going to say, hey Sam, upon listening to your lung sounds, noticing how you're breathing, we're kind of concerned about your airway closing off. So what we're going to do is we're going to be inserting this device through the nose to rest in the back of your throat to help you breathe better. Once the patient has understood, we're moving on to the next step. So the next step, we're going to put on disposable gloves, just clean disposable gloves. If our patient is coughing or has a lot of secretions, it's highly recommended that you wear a mask, goggles, or a complete face shield. That way you don't get any of Sam's secretions on you. Next, we're again going to confirm the size of our device, measuring from the tip of the nose to the earlobe. Once we have confirmed the size, we are moving to the next step. The next step, we're going to raise the bed up to a comfortable working height. After that, if Sam is alert, which he is, we're going to keep him in the semi-Fowler's position. If he were not conscious, we would put him in a sideline position with him facing you. But Sam is awake, he's alert, he's in semi-Fowler's position. He doesn't have a lot of secretion, so the next step is not necessary. We don't need to suction him at this point. Next, we're going to pretend like I am using some lubricant to lubricate this device. So I'm using a water-soluble lubricant to lube up from the guard rim all the way down to the tip. After it's been lubricated, we're going to insert the airway, narrow end first, the tip, into the nostril with the easiest access. So you can do that by pressing one down, seeing which one is breathing easier. All right, so we've determined that we're going to go through one of the nares. Again, this is going to be a little difficult to do on myself, but we're going to go for it. So we're going to go through this side up, and then we're going to slowly insert this device all the way till it reaches the back of the uvula, and then the guard rests against the nares like this. Kind of have to use your imagination on that one. So after we believe we're in the right spot, we're going to visualize the airway behind the uvula. So you're going to want to take a flashlight. You're going to want to have the patient open their mouth, and you're going to visually see the tube passing and resting by the uvula. Next, you're going to assess your patient to see if there's any blanching or skin stretching. If the device is too big, just to help prevent skin breakdown or irritation or keeping your patient from becoming too uncomfortable. So that would be the next thing you would assess. After all that's said and done, you've assessed placement, you've checked the nose, you're going to lower the bed again, take off your gloves, and perform hand hygiene. The other way you're going to confirm placement of this device is you're going to have them close their mouth, and they're simply going to breathe through their nose. And what you're going to do as the nurse is you're going to put your fingers right here and see if you can feel air passing against your fingers. That's another step that you can use to confirm placement. So depending on your facility, will determine the next step. So we've already inserted the device. It should end up looking something like that there. And I have another picture. So we shined our flashlight right through here, and we can visually see the tube behind the uvula. We put our fingers against Sam's nose. We can feel breaths passing through the fingers. He doesn't appear to be in any sort of pain. We're going to reassess our patient, noticing any sort of, if we notice any better normal lung sounds, better oxygen saturation, things of that nature. So again, the last step, depending on the facility, like I said, you'll want to remove the airway every hour and switch which nostril it's going into. So the way you would clean it is just with warm soapy water. Again, you're doing this every 8 hours and making sure that you adjust which side or adjust each nostril. So that's how you insert the device. I hope that makes sense. I know that this isn't near what a nasal trumpet looks like, but we're working with what we got. So I hope that all makes sense, and thank you for joining.